6 months in space. That's all it takes for the human body to undergo changes that would take decades on Earth. But here's what most people don't realize. These aren't failures of NASA's training program. They're the inevitable cost of leaving Earth's gravity behind. If you watched part 1, you saw the incredible preparation. Now it's time to see what that preparation is actually for. Welcome back. Effects of spaceflight on human physiology. Cardiovascular changes, immediate, first 24 hours. Microgravity triggers fluid redistribution. 2 liters of fluid shift from lower extremities to upper body and head, increasing central venous pressure by 40%. Blood volume decreases 10 to 15% as kidneys register overhydration and excrete fluids. Heart rate increases 10 to 30 beats per minute during first week, despite decreased workload. Cardiac deconditioning begins immediately. Vestibular system adaptation, hours 1 to 3 days. Fluid shift in inner ear otolith organs causes spatial disorientation. 50% of astronauts experience space adaptation syndrome, nausea, vomiting, vertigo, within 24 hours. Susceptibility correlates with vestibular sensitivity. Pre-flight caloric testing predicts severity with 70% accuracy. Symptom duration averages 3 to 4 days. Bone demineralization, weeks 1 to 6 months. Mechanical unloading triggers osteoclast activation. Bone loss occurs at 1 to 2% per month in weight-bearing bones, femur, tibia, lumbar spine. Total mission bone loss, 1 to 2% for 6-month ISS missions. Load-bearing bones, spine, hip, lose more than non-load-bearing, radius, fibula. Calcium excretion increases 100 to 150 milligrams daily. Muscle atrophy, week 1 onward. Type 2, fast twitch fibers atrophy preferentially. Leg muscle volume decreases 5% first week, 20% by month 1, up to 40% over 6 months. Anti-gravity muscles, soleus, vastus lateralis, iliopsoas, suffer greatest loss. Protein synthesis decreases 10 to 15% despite adequate dietary intake. Microgravity signals muscle protein breakdown pathways. Immune suppression, days 1 to 14. T lymphocyte counts decrease 30 to 50%. Stress hormone cortisol elevates 2 to 3 times baseline. Cytokine production, IL-2, IFN-gamma, drops 40%. Astronauts show 50% reduced response to pathogens. Risk of reactivation latent viruses, herpes simplex, varicella zoster, increases. 70% of long-duration astronauts shed herpes viruses. Vision changes, weeks 1 to 12. Optic disc edema develops in 50 to 75% of long-duration spaceflight astronauts. Intracranial pressure increases due to fluid redistribution. Mean intracranial pressure rises 3 to 7 millimeters of mercury. Cotton wool spots appear retinally. Visual acuity decreases 0.5 to 1.0 diopters. Mechanisms remain partially unclear, but may relate to choroidal thickening. Cardiovascular deconditioning. VO2 max decreases 7 to 20% over 6 months, despite exercise countermeasures. Maximum heart rate decreases 5 to 10 beats per minute. Orthostatic intolerance develops. Blood pressure regulation dysfunction causing dizziness upon return. Arterial baroreflex sensitivity decreases 60 to 70%, impairing blood pressure control. Metabolic shifts. Glucose metabolism worsens despite unchanged diet. Insulin sensitivity decreases 10 to 20%. Lipid metabolism shifts toward increased triglycerides and decreased HDL cholesterol. Growth hormone decreases 50%, contributing to protein catabolism. Thyroid hormone metabolism alters. T3/T4 ratios shift. Post-mission recovery and rehabilitation. Immediate post-landing period, days 1 to 7. Upon landing, astronauts experience acute deconditioning. Orthostatic intolerance peaks at landing. Systolic blood pressure can drop 20 to 40 millimeters of mercury upon standing, causing syncope risk. Balance deficits occur in 100% of astronauts. Gait speed decreases 30%. Walking asymmetry develops. Coordination testing shows 30 to 50% performance decrements. Structured rehabilitation protocol. Phase 1. Acute recovery, days 1 to 14. Recumbent and supine exercise only, stationary bike, rowing machine. Gradual mobilization with fall prevention protocols. Compression garments maintaining 20 to 30 millimeters of mercury leg pressure. Sodium and fluid supplementation, up to 3 grams sodium, 2 to 3 liters fluid daily. Tilt table training 2 times daily, progressive angle increases. Vestibular rehabilitation, gaze stabilization and balance exercises. Phase 2, early mobilization, weeks 2 to 6. Progressive standing exercises with support. Treadmill training beginning at 1 to 2 miles per hour, increasing 0.5 miles per hour weekly. Resistance training 4 times per week using equipment accommodating deconditioning. Swimming and pool-based exercise, non-weight bearing. VO2 max testing and cycle ergometry baseline assessment. Phase 3, return to function, weeks 7 to 12. Unrestricted weight-bearing activities. Sport-specific training, rebuilding functional movement. High-intensity interval training gradually increasing. Return to pre-flight fitness levels. Target 90% baseline by week 12. Recovery timelines. Most physiological parameters recover. Balance and coordination, 1 to 2 weeks in 70% of astronauts. Some retain deficits at 45 days. Cardiovascular function, 4 to 6 weeks for orthostatic tolerance. VO2 max recovery requires 8 to 12 weeks. Muscle strength, 50% recovery at 4 weeks post-flight. Complete recovery requires 5 to 11 months. Bone density, slower, only 50% recovery of lost bone density within 1 year. Some astronauts show persistent deficits. Immune function, normalizes within 1 to 2 weeks. Vision, resolves in 90% of astronauts within 6 to 12 months. Some changes persist long-term. Long-term health risks. Radiation exposure. Astronauts receive 0.3 to 0.7 millisieverts per day on ISS versus 0.003 millisieverts daily on Earth. Cancer risk increases with cumulative exposure. NASA limits career exposure to 3% increased lifetime cancer mortality, approximately 600 millisieverts effective dose. Increased cataracts risk. 1 to 2% cumulative incidence per 100 millirems exposure. Intervertebral disc herniation. Spinal unloading causes disc expansion and fluid redistribution. 50% of astronauts show disc herniations post-flight. L5 to S1 discs most affected. Symptoms develop weeks to months post-flight. Incidence correlates with mission duration. Cardiovascular deconditioning, long-term. Astronauts show persistent reductions in orthostatic tolerance at 6 months post-flight. Risk of hypertension may increase. Some studies suggest elevated cardiovascular disease risk, though causality remains debated. Vision changes persistence. 15% of astronauts retain visual acuity changes 1+ year post-flight. Mechanism involves intracranial pressure, optic nerve sheath fluid accumulation. Long-term consequences unknown. Radiation cataracts. Risk increases 2 to 3% per 100 millirems exposure. Dose response linear above 50 millirems. Latency, 5 to 30 years post-exposure. Countermeasures and mitigation. In-flight exercise protocol. Astronauts complete 2.5 hours daily exercise minimum. Treadmill running with harness, 1 hour. Maintains cardiovascular fitness. Resistive exercise, 1 hour. Utilizing leg press, chest press, deadlift simulators working against springs. Aerobic cycling, 30 minutes, maintains VO2 max, reduces cardiac deconditioning. Combined protocols reduce bone loss 40 to 50%, muscle loss 30 to 40%. VO2 max decline limited to 7 to 10% versus 15 to 20% without exercise. Pharmaceutical countermeasures. Bisphosphonates, zoledronic acid, reduces bone loss 50 to 70%, not widely used due to gastrointestinal side effects in space. Vitamin D supplementation, 4,000 to 5,000 IU daily, showing modest benefit. Estrogen, women, limited data, some evidence of benefit in bone preservation. Sodium supplementation, maintains blood volume, 3 grams daily, common protocol. Artificial gravity research. Centrifuge-based systems generating 0.3 to 0.7 g showing promise. Animal studies demonstrate prevention of bone loss, muscle atrophy. Human trials pending for future long-duration missions. NASA's medical protocols represent decades of spaceflight data and countless research studies. Yet each mission reveals new physiological challenges. As we push toward Mars missions lasting 2 to 3 years, the medical screening, training, and countermeasures will need evolution. The human body wasn't designed for space, but science is engineering solutions to make it possible.